Pulmonary edema, fluid in the lungs, also known as pulmonary edema. We can understand it laterally. Fluid builds up and is accumulated in the lungs tissue. Most common cause of the pulmonary edema is shortness of breath, which cause fear and anxiety. Also cause orthopnea. The second cause is cough. Wet cough with prothespotum that is sometimes tinged with blood, giving it a pinkish hue. Classical patient, older individual with a history of hypertension or heart disease who is usually obese or overweight. Pulmonary edema was pleural effusion. Fluid in the alveoli in the lung tissue is called pulmonary edema, and pleural effusion, fluid around lungs in the pleural cavity, is called pleural effusion. X-rays, ultrasounds, and CT scan. Heart failure, 70% of pulmonary edema cases, vascular disease, heart wall disease, hypertension, cardiomyopathy. Fluid accumulation in different parts of the body, especially in the feet and legs. Diuretics, ACE inhibitors, or ARBs to lower blood pressure and reduce heart strain, and anticoagulants to prevent blood clotting. Acute respiratory distress syndrome ARDS, 10 to 15% pulmonary edema cases, severe form of lung failure caused by severe infections, traumas, or other injuries. Kidney problems, 5% to 10% of cases being attributed to chronic kidney disease or acute kidney disease. High altitude pulmonary edema HAPE, ascent to high altitude rapidly without adequate acclimatization. Management. Pulmonary edema generally does not resolve on its own and requires treatment. Common treatments include diuretics, vasodilators like nitroglycerin to reduce the heart's workload, and sometimes inotropic agents to strengthen the heart's contractions and improve its pumping ability. A low sodium diet can decrease fluid retention, and regular physical activity and exercise help maintain cardiovascular health. Direct suctioning or drainage of fluid from the lungs is not a standard treatment for pulmonary edema, but it's commonly used when there is fluid in the pleural cavity or around lungs, called pleural effusion. The prognosis for pulmonary edema heavily depends on the underlying cause, but to say generally, acute pulmonary edema develops rapidly and is a medical emergency, while chronic pulmonary edema usually develops slowly and is often caused by cardiac problems. Non-cardiogenic pulmonary edema has a better prognosis compared to cardiogenic. In the case of cardiogenic pulmonary edema, the prognosis is worse due to the typically underlying heart failure and its